Hello, I'm Dr. Latham. In our office, we believe in creating comforting dental memories. A common thing that we do are dental fillings, and this is what happens when you get cavities. We've got to get rid of those cavities. We need to remove that bacteria that's in there that's eating that tooth apart and replace it with something else so you have something to chew on. And when we do that, whatever we put in as a filling, we're hoping to last about 10 to 20 years. In dentistry, that's usually what we expect to see things last. It's a pretty good window. So a lot of times, if your fillings are more than 10 to 20 years older, that means that there's a good chance bacteria is getting between the tooth and the filling. It could be cracks happening on the filling or on the tooth. It's really good to look at those and see if they could use to be replacing because of decay happening and eating part of the tooth away. One of the things that happens is the outer shell of the tooth is a lot harder than the inner part of the tooth. So when the bacteria gets through that hard outer shell, a lot of times it starts to eat the inside part of the tooth out more than it did the outside. And so what looks like a small cavity on the surface can actually be a very big cavity underneath. And that includes filling. Sometimes it just gets around, the bacteria gets around that filling and then to the under part of the tooth and really gets a big amount of decay happening on that tooth and can lose a lot of the tooth. So the sooner that we're able to find those things, the sooner that we're able to take care of them, the more likely we'll be able to save the tooth and be able to replace the filling versus looking at needing to crown the tooth because of how much tooth could have been lost or cracks or decay getting into the nerve and causing pain and needing to have the nerve removed with the root canal. So those are a lot of the things that you can expect to have happen if a cavity is left to get bigger and bigger.